Okay, in the interest of time, I know we'll have a few more people join us, but I'm going to get started. My name is Dr. Jason Boyers, and I am the new president here at Rosemont College, and I'm excited to be here with you. Today, you're going to have the opportunity to hear from our provost, to hear from our partners at Mainline Health, and to hear from myself about what is going to happen as we begin our semester here at Rosemont College. And I'm very excited to um, get a chance to talk with you a little bit. This has been a period of time where we've tried to intentionally look at what we're doing, why we're doing it, and make sure that we could come up with a plan that would reduce risk but allow us to enter in it into in-person instruction. And we want you to have the opportunity to ask questions today. I know we had some questions pre-submitted. There's also going to be an opportunity for you to type in your questions as we go forward. Next slide, please. That question and answer at the bottom of your screen gives you a chance to ask a question. And what I would encourage you to do, don't wait till the end. You'll forget your question. If at any point as we're going through the slides, you have a question come up, type it in there, and that will give us a chance to get to it after we're going to start with the pre-submitted questions and then work our way to the live questions. So thank you. Next slide. So one of the things I wanted to talk to you about is the things we've been looking at. When we started putting together this plan, and I came from a University of Michigan, so Rosemont's actually the second plan that I did. It was my first project here as I arrived. We wanted to come up with a plan and figure out how we could safely reopen the campus. And one of the first things we did was form this partnership with Mainline Health Systems, because I want to commit to you, we want to follow the medical guidance on this. We want to make sure that we're always making decisions that make sense from a medical standpoint, from a community standpoint. And we're a part of the community that we exist in. It's not just about Rosemont College, but it's about this greater community in which we live. So we came up with this plan. We formed our partnerships. As we look at things now, and just fast forwarding to our current environment, we see that Pennsylvania numbers, the 7-day average is at a 4.1% positivity rate. They'd like it under 5% to start in-person instruction. And actually, Montgomery County, where we're located in, is actually at a 2.5% positivity rate for the 7-day average. So that means we're almost half of that 5%. We're lower than we actually need to be by almost half. So when we look at those numbers, when we plan, when we put together all the things you're going to hear about today, it was our decision that we wanted to start in-person instruction because we know some students are going to want to be here. They want the in-person academic support. They want the social interaction, even though it's going to be different. And this semester is going to be different, and we realize that. And I'd like to say this is hard. And I'm not talking about just hard for our team. I know we have some freshmen coming in who lost their opportunity to go to maybe their prom or their high school graduation. Families who lost the opportunity to see their seniors graduate. I know we have seniors coming in to Rosemont who have to start their senior year in a very different way. We have sophomores and juniors who are trying to figure out how they can come back to college. And so today, I want to just acknowledge, we know it's hard. We know that it's going to be different. But our first concern will always be how we can live out our mission, how we can support our students, and how we can minimize the risk as we go through. There is no one way I can put a bubble around everyone and make the risk zero. But there are a lot of things, and you're going to hear about them today, that we can do and that we are doing to make sure we follow the best practice of bringing students in person back to our college. As president, I am here and always willing to respond if you need to reach out to me. And you've got my email address there. And I always try to be transparent and try to make sure we get communication out to you. But I can promise, while we won't do everything perfectly, our motivation, our intention will always, and our priority will always be the welfare of our students and our community. So I thank you for coming and spending some time today with us so we could walk through our plan. Next slide, please. So COVID-19 and our campus, we have spent time since May putting together a plan that brings everything into focus on what we're doing in our campus. You're going to hear about how we're going to clean. You're going to hear a little bit about our dining services. You're going to hear from our medical professionals. And everything we've done has been evaluated in partnership with Mainline Health and the Department of Health. And so I look forward to your questions as we go forward. Next slide. So I would like to introduce Dr. Stallkamp and Ms. Eileen Sherman, who are with Mainline Health. Dr. Stallkamp is the Regional Vice President of Medical Affairs, and Eileen Sherman is the Systems Director of Infection Prevention and Control for Mainline Health. So I want to thank them both for joining us and turn it over to them.
Thank you, Dr. Boyers. Again, I'm John Stallkamp. I'm the Regional Vice President of Medical Affairs for at Mainline Health for our Lankenau campus and our Bryn Mawr campus, here with Eileen Sherman. We're really excited to partner with Rosemont College on this. I actually grew up on the main line. I've been here for quite some time and been with Mainline for a while. Rosemont is part of our community, and we really wanted to partner with the college to really work with the college to make sure that when the college students do come back to our community, what we share with you, that it's done safely. And so we're very glad to partner to make sure that the plan in place works well, and that we can have the students safely come back into the community, and we can make sure they have a wonderful experience while they're there. This graph that's up right now is really, again, and Dr. Boyers talked about this, the Montgomery County data. So this is the county that we're in, and how the cases have continued to decrease. So if you can look, we've had a huge spike, and I've been the incident commander here at Mainline Health for the whole COVID response, and we were really, really busy back in April and May, and then since then our volumes have significantly decreased. So the numbers are now at a very much a stable level right now, and a safe level that we feel as though it is appropriate to take advantage of that ability to get back to inpatient learning. Next slide. So real quick, I just want to start with, so people realize what the symptoms of COVID-19 are. I know you've seen this probably a million times on television. Everybody's talked about that. But just the more times we can talk about this, the better, because the key piece is, if you think you have COVID or you think you might have COVID, we really want you to talk to a medical professional, talk to someone on the campus if these develop, so we don't spread it amongst others. And the most common symptoms of COVID-19 can be fever or chills, cough. Some can have some shortness of breath or difficulty breathing. Fatigue is very common, muscle body aches, headache, sore throat, congestion, runny nose, nausea, vomiting, and diarrhea. Probably one of the most specific ones, though, to COVID, and one that I've seen actually happen quite often in younger individuals, especially of college age, is they feel fine, except for the fact they lose their sense of taste and smell. And that's really very specific to COVID. There are a few other diseases that do that, but very few. And so if that would ever happen to you, that's something to really make you think that, hey, yeah, you may actually have COVID. Next slide. So just in general about the illness, about the virus, the majority of people, especially those who are younger, have very, very minor symptoms and do quickly, fully recover within a few weeks, even if they even have any symptoms. So it's really the vast majority of people. Those who are older, have pre-existing health conditions, are at greater risk of severe disease. But again, anyone could have severe disease, but it's much, much less frequent. And only really about 13% of people need hospitalization. And at the height of the epidemic, the mortality rate was about 1%. And it's actually gone down lately as we've kind of gotten to know the virus a little bit more. So it is still high, and it's much higher than the flu that's out there. It's actually about 10 times higher than the flu. Next slide. So we're going to talk about how you can get COVID. Eileen?
Yeah. So COVID-19, as you may have read and heard about, is spread mainly from person to person through respiratory droplets. Droplets are produced when an infected person coughs, sneezes, or talks, sometimes singing, shouting, those sorts of things. Droplets can land in the mouth or nose of the person nearby, or could potentially be inhaled into the lungs once out into the air. So a really important thing, especially when you're thinking about coming back and being on the campus environment, is around how the virus spreads. So the spread occurs most likely from close contact, we believe, within 6 feet or less, for an extended period of time, so 15 minutes or more of exposure. So, to kind of think about it as you're walking across campus, everyone's masked. If that sort of thing would not be considered a significant close contact as far as spread of the virus goes. Droplets can also be transferred from surface by touch and then introduced into your mucous membranes, your eyes, your nose, your mouth. And this is one of the ones that I try to remind people about a lot. Is many of us, we touch our faces much more than we realize. And so when you're out in an environment where you're not able to frequently clean your hands, you really need to avoid touching your face. And always make sure that you do clean your hands, whether it's with soap and water or with an alcohol hand gel, 60% or more, before touching your face. So it's something to really keep in mind that will help with the reducing transmission risk. Next slide, please. So let's talk a little bit about the masks. Masks can significantly decrease the spread of COVID. That's why the Centers for Disease Control and others have insisted that we make this a standard uniform for all of us right now. So it protects both yourself and others. So Dr. Stolkamp and I have our masks. Right now, because we wanted you to hear us, we have some plexiglass in between us. And so just remember that my mask is protecting Dr. Stolkamp and his mask is protecting me. So having that double layer of protection between the two of us. And should be worn at all times when you're on campus or out in public, except for when you're eating. And so eating is going to have to be a much less social thing because we're not going to be able to protect each other while we're eating. Surgical isolation masks and anything that's got multiple layers, 3-layer masks are best, but bandanas and buffs not the best. They really have the least amount of protection, but they certainly are better than nothing if you have nothing else to use.
Yeah, and Eileen, too, how you wear the mask is also important,
Absolutely.
Right? So you want to make sure you do cover your whole face. We see a lot of people, especially out around in the community, who have their mask around their chin. Mm-hmm. And that really doesn't actually help at all. It really has to be covering your nose and mouth at all times. So that's really, really the most important part on that.
And I think that, most people, they may not realize that it's slipping down below their nose because sometimes it just starts to slip. But really getting that full coverage is very important for both you and the people around you.
Absolutely.
Yeah.
Next slide. So again, we're just talking about physical distancing and what that mask does. And if you look, it's graph's a little difficult to see, but in general, as if you are no intervention, the chance of getting it when you're within 1 meter of somebody is significantly increased when you're not masked. So you can look at the difference between physical distancing, 12 to 8% versus 2 to 6% when you're more than a meter apart or have a barrier in front in between you. From a face mask standpoint, it especially drops the risk, especially if both people are masked. And then just to give an example, we've been dealing with COVID in the hospital for quite some time. We have 11,000 employees. And so far, we've only had a little over 300 employees who've actually tested positive for COVID. And these are people who are spending all day with COVID-positive patients. And they're masked, and they're doing fine with masking. And in fact, most of our employees have actually developed it from not the patients.
That's right, from the community outside of work. Mm-hmm.
Next slide.
Yeah, so social distancing, you're going to notice when you come onto campus that there's going to be signage and markings and things to help you and remind you to keep that 6 feet of distance away from each other whenever possible. And then The other thing to think about is needing to form, small circles of friends and groups, so that, I know Dr. Boyers has said in some other conversations with us, keeping us all in that bubble, right? So the smaller your circle, the less likely you are to bring in more, COVID from exterior, groups. So just keeping in mind small groups, as best that you can, because the large, the more, if one individual in that group has two larger groups that they circulate with, that's going to be a risk for everyone, right? So we want to try and keep that very small whenever possible. And on the campus, we're considering that a small circle, right? I mean, you're going to have small circles within your classes, small circles within your where your living spaces are, but doing that within the community of Rosemont is a safe thing to do. And then obviously, I mentioned earlier, separating while you're eating, because we can't mask, can't protect, and then wearing that mask whenever you're with others.
Next slide. So what's the college doing to help prevent you from getting COVID-19? And we've had a great partnership with Rosemont on working through this, and they've had some great plans to start with. But the most important thing about COVID-19 is there is no one thing that is going to prevent you from getting COVID-19. You can't say one strategy, we're just going to mask everybody and we're going to be great and there's not going to be an issue. It's a multi-pronged approach. There are multiple pieces that need to be done in order to help prevent COVID-19. And I think, Rosemont has done a great job with this, requiring everybody to be wearing masks, social distancing, setting up the classroom in different ways so that people are further apart, cleaning, frequent cleaning, what Dr. Boyers will go into, facility changes, things such as turning off the water fountains and making sure the classrooms, people are spread apart more than they would have been in the past. And then symptom monitoring, making sure that everybody is checking themselves regularly that they don't have symptoms. So in case it does happen to show up in the campus, that it can be dealt with quickly and can be isolated and quickly reported. And then we've talked about testing. And so we've worked with the college and recommended a testing strategy that's in place. We really feel as though the most appropriate is this initial line of testing to kind of make sure that everybody coming initially into the bubble is COVID-free as we can make sure that they are. And then going forward, really monitoring for symptoms going forward, and then testing and appropriate isolating if anybody does even have anything similar to what could be considered COVID. Next slide. Dr. Boyers, back to you.
Thank you very much. So just to add to that, so we're doing a baseline test, and they would call it a prevalence test. Make sure that we come in as much as we can, because testing is a picture in time, and so we're going to have that prevalence testing. But then and I think last time I had a town hall, I got a little ahead of ourselves. We do have that multi-pronged strategy that I'll get into in the next slide. But understand, all students, faculty, and staff will be tested for that baseline prevalence test. If you want to go to the next slide. So masks and social distancing are required. And we have set up every classroom, every shared space to make sure we're meeting the standard of social distancing. And Mainline has been great because they have their facilities people who handle their ICUs and all of their facilities and different kinds of facilities in which they have at the healthcare. They've come in and walked our campus to make sure that we were practicing and making sure we were following best practices. We have a new app that you can get from the Google or Apple App Store. It's called Raven Safe. That will be available, and you'll be getting information about this in your email, so please keep monitoring your email. Every morning, we're asking people to do a daily symptom check on the app, and it will give you a green check once you pass. If you don't pass, and you're a residential student on campus, it will give you a red X, and then you should report to the Wellness Center. And this daily symptom check is another part of this approach that Mainline Health helped us develop, so that we can make sure we're checking from the first sign of challenges. Again, Testing on a too frequent basis is not recommended. We're following the best practice of what has been recommended by our health department, by CDC, and by Mainline Health. So we're going to go after the prevalence test to a system monitoring, and then trying to basically address the symptoms and do tests when necessary. The entrance is going to be monitored 24/7. We have a modified guest policy, and I know we're going to get into questions about this. Again, we're trying to keep that bubble as much as we can. And that's why we have limited who can visit. And also why we've limited as far as dorms. So each dorm is kind of its own bubble. And I've heard, well, we go to classes with these students. You're right. In classes, you're in those shared spaces that are socially distanced, and you should be wearing your mask. In somebody's dorm room, you're in their intimate space. And so we're trying to keep the dorms as kind of their own bubble. You'll be able to go into the shared spaces, the lobby, but we don't want necessarily you to kind of go from one dorm to the other and into someone's room. Food service modifications. We have worked with Parkhurst, our food service providers. Not only have we socially distanced the dining room, we have an outside space that you're going to be able to go and bring your food and eat, so you can eat outside. We have grab and go, so you can grab your food and go to maybe back to your dorm or wherever you want to go to eat. There's going to be choices for you. We have gone to every building, forced every building as far as the air is concerned. We're upgrading the filter to the superior level for businesses. And basically, the only level above this filter is for research labs and medical facilities, and the system has to be built in a certain way for those. But we have the most upgraded filtration we can get in our system. Enhanced cleaning and sanitizing. So one of the things we did is we've invested. We've done a deep cleaning of all of our facilities before you arrive here, including residence halls, and then we have actually paid for extra staff. Dorms and residence halls are going to be cleaned a few times a day. We have individuals that we brought on to make sure they're cleaning them throughout the day. And we have a whole list of enhanced cleaning and sanitizing procedures you can find on our website if you go to Rosemont 2020. And then protocols for isolation positive tests. I've been on so many calls with different colleges, and this is one of the points that I like to bring out. Sometimes at private colleges, I'm hearing they may have 1 to 2 to 5 spots to isolate. If someone has a positive test, or if we suspect they might, we do have isolation beds, and we've been able to set aside about 10% of the number that we have on campus, the residents that we have on campus. About 10% of beds are set aside for that isolation. So that if you have symptoms and we're testing you, we're waiting for the test to come back, we will isolate you so that you have a place to go, and we can provide food service and take care of you. If you test positive, our first recommendation will be for you to go home. If you can't, because let's say you have a vulnerable person in your household, that is okay. We're going to have an isolation space for you until we get you to a point where we can re-enter you into the system or into the general population. And again, we're following the guidelines based on the medical advice we get. So those are some of the key things we're doing. If you want details on those plans, please go to Rosemont 2020. Every communication, every policy we're putting on this website. It has a navigating bar. You can find out all the information. We want to be as transparent as possible. Next slide, please. For the revised guest policy, 1 campus visitor for the semester, 1 emergency contact, and 2 individuals who are going to receive periodic emails. We want to make sure, so we have a thing in higher ed called FERPA, which means unless students specifically give us permission, we can't communicate directly with you about anything specific to that student. But what we are going to do is keep you up to date in general announcements for the campus and what is going on, and if we have a positive test. We're going to communicate, and I'm committed to make sure we communicate as soon as we know information, we're going to pass it on. But in order to do that for your family, outside of your student, please go to this website, rosemont.edu/Rosemont 2020, and click on the guest policy. Again, that's the website that we're posting all information to, and it's going to prompt you to give us an email address in which we can send general announcements. And that's going to be important because we are all in this together. It's kind of a phrase you've heard everywhere. But in order to be all in it together, we want to make sure we're communicating with you in the best way we can. Next slide, please. We're putting up over 700 plus signs all over campus to remind our community what they need to do. From signs that talk about social distancing, next slide, to classroom protocols on how to attend class, next slide. Just reminding everybody that we have a chance as a smaller college versus a large university. We have a chance to keep our bubble here. The county numbers, the area in Pennsylvania we are, and Pennsylvania really as a state, the numbers are heading in the right direction. So as a small college, the power of small, we have a real opportunity to keep our community safe. But we are all in this together. If I have students on here, not just parents, but students, hear me when I say this. Your masking does protect other people. What you do in your free time, you can still connect with students. We have our student life group is putting together all kinds of activities to make sure you have that social part of your educational experience. We're putting together activities to engage you from your intellect to your emotional to your spiritual side. But staying in that bubble, following those guidelines, you're protecting the people who are really your family here on campus. And when I came to Rosemont, I got a chance to see many different kinds of messages that kind of pop out. But in the president's office, there's a water bottle that says, "We are our values." Here's a chance to prove what the power of small means. We have to take care of each other. That's what this is about. And it's not that it's going to affect maybe one or another person. It's that our actions will have impact on others. Whether it makes them sick, whether they're asymptomatic, or whether they may be in the vulnerable population. Some of your faculty, some of the staff, they're here for you. So we're depending on each other to follow the guidelines, to stay masked, to really think about what you're doing when you leave campus. And obviously, we're not going to be a prison. You can leave campus. Some of you are going to work. We have commuters coming in. But if we all follow the guidelines, we can really minimize the risk and work hard to keep our communities safe as we go through. Next slide. You're all going to get, as a part of the student handbook and sign that you're going to follow, is you're going to get our promise to you and your promise to us. That's to say that we both have responsibilities on each side. And I really believe, I can tell you, your faculty made it a point to tell me that they have a lot of faith in our community. So we're in a partnership here. We're in this together. Go ahead, next slide. The next slide, I think I talked about that. And so now I'm going to turn it over to our provost, Dr. Dowling.
Thank you, Dr. Boyers. Good evening, everyone. Thank you so much for joining us. By now, I'm sure you've heard quite a bit about our academic plan for the fall. As you know, it's called 2 Terms, 1 Focus. And that basically allowed us to divide the fall semester into 2 7-week terms. This plan provides us with an incredible amount of flexibility to deal with whatever we face, to adjust to situations, to respond to different and changing situations, but always with the goal of doing what is in the best interests and safety of our students. One of the features of the 2 terms, 1 focus is that every course for the fall semester is a hybrid course. And what that means is that it's a combination of both in-person delivery and online. We further reduced the in-person, in the classroom, face-to-face delivery to 50 minutes per week per class. Now, one of the things that this allows us to accommodate is any student who, for whatever reason, decides he or she wants to remain online and at home during the semester. Some students commute and have a long distance to travel and felt that 50 minutes was a long way to travel just for class. Others may have personal reasons that they need to remain at home. If any student is in a situation like that, that student can remain at home and participate as if he or she were actually in the classroom. The reason we can do that is that we have state-of-the-art technology in our classrooms, what we call smart boards, where using our LMS, our learning management system, Canvas, a student can log on and actually participate live during that 50-minute session. The remainder of the class will be delivered online through various activities and assignments and group projects. That's all spelled out in the different syllabi, the different courses. What we're asking is that if you decide that this is what you'd like to do for the fall, please let us know no later than Monday at noon. You can do so by emailing my office at provost@rosemont.edu. You will be notified shortly thereafter about the next steps. We have ample training on how to use Canvas for all students. This doesn't just relate to students who remain fully online, because everyone will be participating in Canvas. Everyone is participating online because every course is hybrid. So if you decide that this is what you'd like to do, you would like to remain fully online for the fall, email me by no later than Monday noon. We will then follow up. Your professors will know. Everything will be fine. We'll take care of everything you need. And of course, I'm here to answer any further questions you might have about that. So next slide. I think it's time for Q&A.
Yes, time for Q&A. I'm going to turn it over to Kristen.
Thank you very much. It's lovely to be with all of you today. And as Dr. Boyers mentioned at the start, I'm going to begin with the questions that were submitted online at registration. We have about 12 of those. Some of them were similar, so I've grouped them together. And once we make it through those, I'll turn over to the live questions. We have about 5 of these at present. So this is a question for Dr. Boyers and for Dr. Stallkamp. And it is submitted by Callista and Sharonda, who are both parents from Philadelphia. Their question is, how often will COVID-19 testing take place on campus this semester for all students and employees?
So I'll start, and then John, feel free to jump in on this. Testing was something we talked about, and we really wanted to follow the best practice of testing. And so I talked about it with Mainline Health on a couple of different occasions, and I made recommendations, kind of like when you go to your doctor and tell them, you know, this is what you think they should do. And they were helpful in helping me understand what might be effective and what might not. And so we're going to do this prevalence testing, then we're going to do the symptom checker, and we will test symptomatic individuals. If we have positive tests there, and we define an outbreak as 5 positive tests on campus, right? Then what we're going to do is we'll determine then the frequency of having tests more often and beginning testing so we can gauge if we have beyond that prevalence in our community. So one of the things was do this first test, make sure we start on a bubble, do the symptom checker, and then beyond that, if we run into positive tests, then we can determine how often in doing testing from an asymptomatic standpoint. But mass testing on a frequent basis is not recommended by the CDC or the Pennsylvania Health Department. And in fact, they would recommend the opposite of that, and they recommend just doing the symptom check. We're doing the screening because we want to make sure we start out on the right foot. John, Dr. Stockham, anything?
Yeah, Dr. Boyer, so you did a wonderful job on that. No, we agree, and we talked about this initially, and do feel that, you know, your initial screening test is enough. I mean, more than enough, actually, and again, consistent with the recommendations that the CDC have. They wouldn't even do that, but we think it's safest to do that initially to start with, and then to follow along with that symptom checker and the masking and all the other pieces that we're taking care of here at Rosemont, really to help prevent any spread of COVID-19.
Thank you both. Our second question is actually submitted, a very similar question from 3 parents from Philadelphia, Philip, Callista, and Jacia. I hope I'm saying your name correctly, Jacia. How do you plan to keep all spaces on campus sanitized? And then a similar question, specifically, how will shared bathrooms and showers that are in constant use be cleaned?
Yeah, so a couple of things. One, again, we have went with an enhanced cleaning solution with our partners with Aramont. Now, those of you who may not be familiar with Aramont, they're not just, you probably heard the name, maybe you've heard it in food service, but Aramark is kind of the gold standard on facilities, institutions. They actually work with quite a few nationally healthcare facilities, hospital systems, et cetera. And so we have gone with that enhanced cleaning. Spaces are going to be cleaned throughout the day. For shared restrooms, let's talk about shared restrooms. So they're going to be touching shared restrooms a few times a day. Along with that, again, those 700 plus signs on how to use a shared restroom is going to be a part of that as well. The cleaner, the sanitizing spray they're using is upgraded and it is proven to kill the COVID virus if it should exist on the surface. And so all of those things are being put in place. For the residential dorms, again, we have actually had them staff up so that they have an individual staff member who throughout the day is responsible for each dorm to make sure that cleaning takes place. And I would suggest I could go through what we're doing from the deep cleaning to start out with to the multiple cleanings. The best way to look at it step by step is on Rosemont 2020. But we wanted to make sure for the protection of our students and our staff that we kind of upgraded to that enhanced cleaning process. And we're thrilled to have Aramark as a partner. Again, they're the gold standard in institutional cleaning. So we're excited to have them partner with us and work with us.
Thank you. Our next question is an anonymous question from a parent, and it is for Ms. Sherman and Dr. Stallkamp. Can you tell me what counts as contact that would need to be reported in contact tracing? How is my son supposed to remember the people he is around all day in a college setting?
So contact tracing would be initiated if an individual were found to be positive for COVID. We would first, at the Wellness Center, would have a conversation with them to first get an idea of who they have had interactions with during the time of their infectious state. So along with that, they would you know, think through their schedule and who they interact with on a routine basis. Another thing that we have asked all to consider is day to day, as you're kind of doing your symptom checker, and then towards the end of the day, think about logging your interactions through the day so that you may have, you know, fresher ideas about what you've done in the last, you know, so many days in case that were to become an issue. But for the most part, the contact tracing is going to be initiated through from the person that is positive out, you know, so that individual would have to be able to report on their interactions.
Yeah, and again, I would just add, you know, we touched on this briefly, but again, the whole idea of being within 6 feet of somebody, for greater than 15 minutes. So again, you walk by or someone else is, is at the other side of the room or anything like that. And as long as you guys are all masked on a regular basis, your chances of actually getting COVID-19 are very small. And it's pretty easy to remember throughout the day those few people that maybe you were shared in the dorm room with and you didn't have your mask on. Those would be the kind of the things to remember, but not every single person you walked by with on campus. That would not be considered a risk.
That's a great point. We wouldn't need to keep a comprehensive list of everyone you passed along the way because everyone is masking and staying distant.
And washing your hands.
And washing your hands, please.
Thank you. Our next question is a two-part question. It's submitted by Michael and Christine, who are parents from Brookhaven, Pennsylvania. What is the recommended procedure to follow if a Rosemont student is not showing any signs of illness, but has come in close contact with a sibling, parent, roommate, or partner, and they've developed, and they, the partner or sibling, has developed symptoms of a sore throat, fatigue, and runny nose? These symptoms could be cold or allergy symptoms. However, they can also be signs of COVID-19. Should the Rosemont student attend in-person classes, or should the student attend online temporarily? And then the second part, if a student has seasonal allergies, what should the student do as far as in-person classes go? How will the college know if it's allergies or something more serious? And just in the interest of time, I'm going to mention this is very similar to a question from Lisa, who's a parent from Naples, Florida. What are our procedures if a student has a slight temperature? I'm concerned this will lead to unnecessary testing.
So I'm going to jump in, and then I want John and Eileen to jump in as well. This is why we have the daily symptom checker, and why it's important to understand what is an exposure and what is not. And if you are feeling symptoms, you're going to fill out that daily symptom checker. If you do not pass that daily symptom checker in the morning, that goes right to the wellness center, and they're expecting you to report there. They will then do an evaluation, and if they feel like you need to be tested, they will. But again, I think one of the biggest things I've learned since working with Mainline Health is I think we get inundated with these messages on TV, and we think, oh my goodness, we've been exposed. A lot of times you haven't been exposed, or you wouldn't even be counted as being exposed. Even if that person that you think you had interaction with ends up testing positive, that may not even mean you're an exposure. So daily symptom checkers, you're right. We don't want to lead to unnecessary testing, but we want our wellness nurse, if you're feeling those symptoms, we want you to be evaluated, which is why you'll be going there. And you're not going to be treated differently. All we're doing is working to protect you. But remember, as you wear masks, as you socially distance, you are in a way protecting others, because your chance of getting COVID really goes down. Is that fair, Dr. Starkamp, Eileen?
Yeah, no, I think you hit that very well. Again, if you were, you happen to be someone at home that you happen to visit, happen to be sick, again, communication back to the wellness center is incredibly important. That person should be tested, and as long as you're not having symptoms or something, I think that's fine. If that person turns out to be positive, that's a different discussion, and we would treat that differently and evaluate how close you were, how much time you spent with that individual. If you have seasonal allergies, yes, absolutely, it can be a sign and symptom of COVID. It can be hard to kind of judge which way or not. Again, I would talk to the wellness center, have a conversation with them, talk a little bit more specifically about your allergies, or talk to your primary care physician that you would have at home too. Have those conversations with them and move forward. There could be some unnecessary testing. I personally prefer over testing than under testing. I think it's actually a better thing to do just to make sure. If you do have a fever, college kids don't get fevers as much as they used to. As you think, as your kids are getting older, they're not getting fevers as much. And so having a fever, 101.5 fever, that's pretty significant for a college student, and that's definitely worth being evaluated and being seen and getting tested, unless there's another reason for that fever, like a urinary tract infection, which is a common cause. But again, talk to the wellness center.
Thank you. So our next question is a question from Maria, who's a parent from Drexel Hill, and it's very similar to a question that was submitted live, so I'm going to combine them. The question that was submitted live is from an anonymous attendee. If a student tests positive, will the entire campus need to isolate? And Maria's question is, what are the college's procedures should a student test positive for COVID? Will they stay on campus or go home?
And I would add that you're going to, again, I'm going to direct you to Rosemont 2020. You'll see our procedure. I want to be transparent with you. But understand, again, as I'm sure you've heard now as we've had the discussion, the whole campus would not need to be isolated because the chances are that that person was within 6 feet for longer than 15 minutes with the entire campus is unlikely. But that person could be isolated. If they could go home, they could go home. If any, we would then do contact tracing. If anybody met that definition of exposure, we would isolate them. That's why we've set aside those beds to make sure they can be isolated safely. And again, we take care of them. We have the ability to give them food service. We have the ability to take care of those residential students. But the entire campus wouldn't shut down because we have one person who tests positive. An outbreak is 5. At that point, we're probably doing more testing than we would before that, just to be safe. But even at that point, the college wouldn't shut down because when you mask, when you socially distance, if you follow the guidelines that we're putting in, it's going to protect the campus community, even if we have a positive. And it's possible, that it's going to happen during the fall semester. But following our guidelines, our protocols, and again, those protocols will be put up on the website. You're going to know exactly what we're going to do, but it's not going to shut down the whole campus. And in fact, I was just on a call with the Department of Health, the State Department of Health here. That's not going to be their first recommendation. Their first recommendation is, not to send the whole dorm home or not to shut down the campus completely, but to follow the guidelines, contact tracing and isolation, and be very thoughtful about how you're doing this rather than sending people just home.
Thank you. Our next question was asked by several parents, and there are actually a few in the live question chat for this as well. Are students allowed to go off campus?
So I would like to point out again, we are not locking your students up. Some will need to go off campus to work. Others will need to go off campus for a variety of reasons. What we're asking people to do, and this goes back to what I talked about earlier, is that bubble we're talking about is actually really a bubble of behavior, right? When you do go off campus, make sure you maintain your masking, make sure you maintain your social distancing, and you follow the guidelines set forth in what will reduce your chance or opportunity to get infected with COVID-19. If you follow the guidelines we've talked about that you would follow on campus, you're really reducing the risk to the whole community. We have commuters who are going to come on, and I know people have asked me about commuters. Again, we're asking the commuters to follow those guidelines. They're also going to be doing the symptoms check, and so they won't come to campus if they fail the symptom check. If we see someone on campus and they come to campus and we notice they may be having symptoms, we may direct them to the wellness center. But it's impossible to put a bubble around everybody. What we're asking people to do is follow those guidelines, and you're going to keep the community a lot safer. And again, I would pass off to Mainline Health to add anything they would like to add.
I think you can't. No one would be restricted from campus. You can't. And look, and I go to the grocery store, at least once a week, and I keep my distance from other people. I have my mask on all the time. I'm using my hand sanitizer, and as long as, again, everybody is doing that, they're keeping their bubble small. I think that's the most important thing. Keep that circle small.
Great.
Thank you. This question was asked by 2 parents, and it's also been asked in the chat. Can students have helpers for a move-in, and why is it limited to 1 person? And I'll give that question to Dr. Dowling.
Yes, there's 1 parent or family member or friend permitted for each student to help move in. And the reason we're limiting it is, again, to limit that circle of friends and to maintain as much of the bubble, if you will, as we can.
Thank you. I'm going to turn it over to the live questions. We have quite a few. There's one that's come in live that was also submitted, and I think it may be the same person. If I choose to take our classes fully online this fall, will I lose my scholarship? And will I be able to return to campus housing in the spring of 2021? This is from a student from New Jersey. I'll give that to you, Dr. Dowling.
Yes, you know, you will not lose a scholarship. Your financial aid package may change a bit because obviously you no longer have the cost of room and board. So we would ask you just to get in touch with the financial aid office, and our director will walk you through how that package changes. And you, by all means, we look forward to having students come back in the spring.
Thank you. There are two questions in the chat related to testing, and Dr. Stalkamp, I'll turn these to you, I think. One is, what is the type of test you will be using? Some concern that the rapid test has shown up to a 40% false positive result.
So there are lots of different tests out there on the market, and so the test that I know that we are using that we're going to have tomorrow on campus is it's a PCR test. So that is a test where we do have a swab that goes just inside your nose. We're not going up to your brain. We're not going too far, but just inside the front nares. And it is a PCR test, and it is actually a very, very good test. It is not a 40% error rate. Those are consistent with more antigen testing, which we are not doing in this situation. This test has really a 90+% accuracy rate. We use it in the same test I use in the hospital to determine if someone has COVID and have a very, very low false negative rate.
Thank you. And then there's another question related to testing, and I'll give this to you, Dr. Boyers. The question is about the turnaround time for test results. The person submitting this question was able to get theirs in time within the 7-day window to move to campus, but they're concerned about a longer window for other students.
Yes, so what we're finding is that in most cases you're going to get those test results back within the 7 days. That's why we set it at 7 days, because we knew where things were. If you've contacted your testing center and you're worried about that, we also send around a link to a kit that comes directly from LabCorp. They FedEx it to you. You submit the test, you can FedEx it back. It comes with a package that you don't have to buy postage or anything. You just FedEx it back, and then you get your results within 2 days. That baseline prevalence test I know it's not the most convenient thing, but it is still important for our campus to start off on the right foot. I think it will help us as we go forward to start off with having people screened initially as they come. If you're absolutely having trouble, that kit is an option. If you need to, you can call us, and we can try to help you work through maybe where we can talk about local aid to get you tested. It's one of the reasons we opened it up to students for the testing we're doing on tomorrow for the freshmen, and then staff and faculty there, and then we have another testing date, September 8th, that kind of matches up with the sophomore students and seniors. So please stay in communication with us. It's not meant to keep you off campus a day longer than you have to be, but we have to have that negative test. It's one of the key strategies we really believe in and that mainline health and have worked towards to keep this community as safe as possible.
Thank you. And there's a similar question about a commuter student wondering if they can attend tomorrow's testing. Can they still sign up for that if they are to be on campus next week?
So Kristen, I believe we have still a few spots available. If they go to the link, they can sign up for that. Absolutely.
Yes, indeed. There is a question about cleaning of residence halls that we haven't heard before. The question is, does that include student rooms?
Okay, so no, that does not include going into students' rooms. Students will be responsible for cleaning their rooms, and there's a lot of privacy issues around that, and just a lot of issues around that. But within their own room, they clean their own room, but any shared spaces, shared restrooms, all of that will be cleaned multiple times a day.
Thank you. There is a question about room assignments and whether a roommate assigned for fall, if a person opts for a totally online experience, will they have the same roommate in the spring? I'll give that to you, Dr. Dell.
If that's what you would like, we can arrange that, certainly. We will probably have to address that individually. So the director of residence life will be in touch with you on that.
Thank you. And then a question related to the Raven Safe app. What is the threshold on your body temperature that needs to be reported every day?
So on the Raven Safe app, and I don't have the list of questions in front of me, but generally fevers are defined as, I think, 101.5. And I'm asking Dr. Stallkamp to correct me if I'm wrong on that. I think that is.
Yeah, that's a long-term debate, but normally we look at about 100.5 and above is where we look at as what a fever is. But I think the most important part in that is just making sure you are checking your temperature at least once a day. You know, I personally check my temperature twice a day. But keep my thermometer right next to my toothbrush, the morning and the evening.
There you go. So, it's, you know, I would state this. I mean, temperatures are one part of it, but there's a whole list of questions there, because temperatures aren't always the best guide.
Yeah, especially I would agree, especially for our younger individuals. I think temperature is one of the less active ones. It's that slight cough, it's that sniffles, it's that fatigue, especially, I think, are more common that we're seeing in younger individuals. And again, loss of smell and sense of taste is a very key one too as well.
We want you to report the symptoms. I'm talking to our college students here. If you went to bed at 3 o'clock in the morning and you get up for an 8 a.m. class, then there may be another explanation for fatigue. But if you're hitting that fatigue and you just can't get going, that's probably an early sign of that, and you need to pay attention.
Thank you. There's a question about whether there will be fees reduced or a refund, given that the semester in-person instruction is ending at Thanksgiving break.
So that's a good question. So here's what we did. If you're a sophomore, junior, or senior, and you're not reporting for a couple of weeks, and what we did was we did two things. One, we adjusted the housing and room and board to make sure we gave you credit for it. And when we looked at the ending at Thanksgiving, which is about a week and a half earlier than what we would normally end as you go into exams, people left at a different time. We have translated that into dollars that will be given to you on your card that you can use during off hours. So you're getting credit for both. You're getting credit on your account for the delayed reporting to campus, and then you're getting some extra Raven dollars. I think they call them Raven dollars, so that you can go to grab a burger in an off time or grab another food to go option. And so both those things, yes, you are getting adjusted for that as well.
Thank you. I think we have time for one final question, Dr. Boyers, and then some closing remarks from you. But the last question is a topic we haven't touched on, which is about athletics, whether we will have a season this fall and whether the teams will be able to practice and/or compete.
So I think that's a really good question, and I've been involved in this. So as many of you may know, we had to suspend our fall season. One of the things the conference is talking about is how to translate maybe the fall season into a reduced schedule, if we can translate some of those sports to spring, because we all are hopeful that by the time we get to January, we're able to safely do those. We have not made a determination on our winter sports, which are the sports that kind of cross over. And a lot of that will depend upon the facts on the ground. And then we'll look at our spring sports as we go forward. So the initial fall sports and those fall seasons have been suspended with a look towards possibly competing in the spring for those. In the meantime, one of the key things we want you to realize is you're still going to be connecting with your team. We're working with coaches on how to organize events and work with the teams We will have our training facilities open, and there's a way athletes are going to be able to schedule for training and keep things socially distanced. So all of those activities will be going on as we go into the fall semester. And they'll be hearing more from their coaches on that. I just talked to our athletic director today, and they're working hard on those plans as well. And so more information to come on that. The fall sports season has been suspended. The winter, a determination will be made by the end of September. Again, depending on facts on the ground. Our first consideration is to make sure we can do this safely and in all ways create an educational experience for our students and a positive experience from a social, sports, and otherwise. So I hope that's helpful. One of the things I talked about is we need to have good plans, but we also need to react to the facts on the ground, and that's what we're looking to do. All of us want to get back to a more normal cadence, but to be honest, we want to make sure what we're doing makes sense, is rooted in science and rooted in the best medical advice we can, and protects our community.
Thank you. If your question wasn't answered, we will do our best to follow up with you. Most of you have been registered by your name, so we will do our best to answer those personally. But in the interest of time, given that it is just a little after 6 o'clock, or excuse me, 7 o'clock, I want to just thank all of you for being here today.
And just in closing, I really appreciate the feedback we've gotten, and I wanted to just thank you all for being a part of this community. I look forward to getting to know you, and I just want to recognize again, this is not easy. I can, while we say, and it sounds flip, that we're on this together, this is a blip. We are going to get past this, but we're going to get past it together. So thank you all for coming today.